Welcome to the latest edition of Women's Health Updates, covering breakthroughs in the past 2 weeks. Brought to you by Lucid Quest. First, new unified guidance for inflammatory bowel disease in pregnancy. Experts advise continuing biologics and thiopurines, avoiding small molecule IBD drugs during pregnancy and lactation, considering low-dose aspirin when preeclampsia risk is elevated, and managing all IBD pregnancies as high risk. This could inform prescribing and payer reviews pending full data. Next, the Preeclampsia Foundation was selected as an Action for Women's Health awardee within Pivotal's $250 million initiative managed by Lever for Change. The grant recognizes work across hypertensive disorders of pregnancy and will support prediction, prevention, management, and postpartum follow-up. Roche reported that oral selective estrogen receptor degrader giredestrant met the primary endpoint of invasive disease-free survival in the Phase 3 lidERA adjuvant study for early ER-positive, HER2-negative breast cancer. Overall survival is immature with a positive trend, and safety was consistent. This is the first Phase 3 oral selective estrogen receptor degrader to show a significant benefit versus standard endocrine monotherapy in this setting, with data heading to regulators and a future medical meeting. From the Americas, Brazil, Chile, and El Salvador shared progress towards cervical cancer elimination. Brazil highlighted high HPV vaccination coverage, adoption of a single-dose schedule, and rollout of a national HPV DNA test, with expansion planned by the end of 2026, signaling scale-up for screening and follow-up. WHO and the International Agency for Research on Cancer launched a free cervical precancer learning program on WHO Academy for officials, clinicians, and community health workers. The modules support the 90-70-90 targets for 2030 by strengthening screening, triage, and treatment capacity. In oncology R&D, the BCL-XL degrader DT2216 began dosing in a Dana-Farber Phase 1b/2 study with weekly paclitaxel in platinum-resistant ovarian cancer, building on Phase 1a recommended Phase 2 dose and preclinical tumor eradication signals. Early clinical readouts will clarify the translational potential. On policy, Ovarian Cancer Research Alliance debuted its Center for Public Policy and an interactive map to track key bills and funding priorities, unifying federal and state advocacy and grassroots work. OCRA's efforts have helped secure $3.8 billion to date for research and education. In digital health, Millie launched Maia, an AI agent for maternal care and clinic operations that integrates into the patient app and a unified data layer to personalize support and automate workflows, aiming to improve outcomes and reduce costs. In Europe, Greece partnered with SERD Health to create a national AI front door to care, beginning with Health Information Line 1566 to enhance triage and coordination. Staff will be augmented by AI with independent monitoring planned, targeting faster responses and real-time system visibility. FamilyWell Health raised $8 million in Series A funding, led by New Markets Venture Partners, to expand integrated women's mental health services across 5 states, advance its AI platform, and grow into perimenopause and menopause care. Finally, DevX spotlighted more than 80 Action for Women's Health awardees funded by Pivotal with Lever for Change. Themes include locally driven models, digital access, and social determinants, responding to chronic underfunding in women-specific health. Stay ahead in women's health research. Like, share, and subscribe for our updates. Visit lqventures.com or email us at info@lqventures.com